You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.
Welcome back to the podcast. I'm here with Kelly Wright. She is the other half of High Venture Healthcare, co-author of these fantastic blogs. She's written a blog today, which we're going to dissect, named The Physicality of Healthcare. Kelly, welcome to the podcast.
Thank you so much for having me again.
It's fantastic to have you back, actually. We're just going to dissect this blog today, really around, you speak to the sort of physical demands placed on healthcare professionals of flight nursing, the vibration of the cabin, the noise, the hypoxia that patients and maybe even the practitioners can be affected by, but also more than that. And your piece really does reflect this, the repetitive lifting, the long hours, and sometimes the psychological burnout. Could it get you to it really resonated with me. Could it get you to speak to the piece?
Yeah, so I wrote this blog when someone made a comment or asked me how in shape, quote unquote, I have to be a flight nurse. And the question just kind of made me pause. I think she was under the impression that I was more in a search and rescue position, which, in some cases we are. My company, we can do sole responder status, but we don't do hoists or anything. But that question really made me reflect on just how physical this job can be. With flight nursing, even if you're doing one or two flights a shift, like you can feel pretty wrecked just from the vibration, the heat, the noise, the stress of the job, lifting the patients, from the gurney up into the aircraft, if you have to, go for a little hike to find the patient. Um, and then that, spiraled into what it was like to work 12-hour shifts in the ER or the ICU and lifting patients that way, being on your feet, which then, spiraled further into physical safety, especially in the ER with, drunk people, people on drugs, the psych population. Um, yeah, and, I'm a pretty active physical person, and this was just a nice way to really put into words and into one space, like just how physically demanding nursing and healthcare can be.
Yeah, and you do know that in the piece actually. And one of the things or aspects I like really about the piece is that you say there is a responsibility for a baseline or a standard of for better equipment and safety protocols from an industry-wide perspective, because like as you were saying, the certainly the workplace violence can be unanticipated but very much present, but also the ergonomic burden, like you said, lifting patients, twisting, turning at all times of day and night, sometimes at very early hours in the morning. And the culmination of that can be physically and psychologically demanding. So almost having policy and workplace standards which not only recognize this but hopefully mitigate some of these burdens in practice. Is that you're across a number of companies actually and indeed positions. Have you seen a real disparity in workplace protocols and equipment?
I've worked in two very high level ones, Stanford and OHSU, and they for sure had the best ergonomic policies. OHSU's ICU had lifts for the patients in every room. So if you had to change their sheets or turn them, you always had the wall lift to help you. Um, and Stanford, I mean, I was there so many years ago, so I don't know if things have changed. But they just always had extra hands, lift team to help you, just so many extra bodies. And that was a big change compared to what I had seen in my first year as an ICU nurse here in Reno with like no lift team, no wall hoist. Just, hopefully you find a friend. Otherwise, like figure it out. And I'll never forget, I was a pretty new nurse and I had a patient that I had to mobilize, because when you're intubated, you still need to mobilize it, improves outcomes. And this guy was doing very well. He was able to be, not sedated. And they told me to take him for a walk. And he was like 300 pounds. I'm 5 feet tall. It's like, like this man has maybe not gone for a walk in like 5 years. I cannot do this by myself. This is, it's kind of also trying to figure out expectations versus reality of what companies are expecting of their nurses. Because that man will fall on top of me and like neither of us are getting up.
Yeah.
So
Yeah, indeed. No, indeed, indeed. And actually, like you said, just making sure there's some safeguarding, but also just you're approaching it in a team as a team. And to your point, just highlighting the risks ahead of time. So you're kind of one step ahead of what the worst case scenario could be. Absolutely. We're going to just about to hear the blog in AI format. You'll be able to read it in the show notes. But Kelly, have you had any post-blog reflections and or feedback?
my personal reflections, my first one was, wow, I don't know how much longer I could do this. A lot of people don't stay at the bedside, their entire career. I'm very happy with flight. I love my job, but I will probably lose my hearing. Your sleep schedule gets absolutely destroyed if you're, getting woken up all night and having to stay up on your 24-hour shifts. So the ergonomics in a helicopter aren't so hard for me being 5 feet tall, but I am kind of thinking of my, circadian rhythm, my hearing, long-term health effects, and, this being a flight crew member may not be my forever thing. And it might be time to start looking into, grad school, whether it's in like management or leadership, like way down the road. But that was my first reflection was, I am 36. I don't know how many years I can actually keep doing this.
Yeah, listen, I think that probably spoke myself and Laura, your co-host and author, spoke about this around essentially, yeah, the longevity of a career at the front line actually and service delivery, but not only on your back, on your mental health, but also on everything, all your other faculties, as you're saying, your hearing,
Mm.
your circadian rhythm, your sleep patterns, it's the whole thing, and it's the culmination of the whole thing on your body and on your mind. Absolutely, yeah, absolutely. It's a fantastic piece actually, and I think it's really good to go away and read this in slow time, especially as we were saying before, maybe in the earlier throes of a career, just to understand some of the hidden factors. I think Kelly, what you do in this piece is fantastic because you call out some of those factors which just aggregate over time, like the ergonomic burden, but also like the vibrations and like the sleep deprivation and what that can do over time. So it's a fantastic piece. Please do go away and read it. Kelly, it's always a pleasure to join you on the podcast. Thank you.
Thank you.
Okay, let's dive in. We talk a lot, I mean a lot, about the emotional stress of healthcare. Burnout, moral injury, all of that. But there's this whole other side to it we need to discuss. The purely physical stress.
The silent killer, you could almost call it.
Exactly. Our deep dive today, it actually started from a pretty simple question somebody asked a provider. How in shape do you really need to be for this job?
And the answer is pretty startling when you dig in.
It really is. Because it turns out healthcare isn't just mentally demanding it. It demands the physical resilience of an athlete, a dedicated one.
That's the core of what we found. People might kind of scoff at calling a nurse or a doctor an athlete, but if you actually look at the physical toll, the injury risk, the sustained exertion,
It's right up there.
it is. It's comparable to some high-risk first responder jobs. Being physically capable isn't just a nice to have. It's essential for your own safety and for having a long career.
So that's our mission today.
Yep. We're going to walk you through two, let's call them operational worlds. First, the high adventure stuff. Think flight healthcare, where the environment itself is actively trying to wear you down.
And
Then we'll shift to the daily grind on the hospital floor, the marathon, not the sprint. And you'll see how that repetitive strain and, frankly, violence leads to some truly alarming injury stats.
Okay, let's start in the air. The thing that really surprised me was the pure physiological cost of the environment. When you're in an aircraft, a helicopter, or a plane, You're hit with stressors that are just, they're unavoidable.
Right. We're not even talking about the emotional stress of the call yet. This is just what the machine does to your body. And the number one culprit is, well, the air itself.
How so?
Most pressurized cabins are kept at an altitude that simulates being at 6,000 to 8,000 feet.
So wait, even if you're in a nice modern plane, your body thinks you're starting your shift on top of a mountain.
That's the perfect way to put it. You have less oxygen pressure, which means less oxygen getting to your tissues. And if you're a flight medic or nurse going up multiple times a week,
That adds up.
oh, it adds up. Acutely, you feel tired, your thinking slows down. And for night flights, this is critical. Your night vision gets worse.
That sounds dangerous enough for one flight. What about the people doing this day in, day out?
That's where the chronic effects kick in. If you keep stacking those flights without enough recovery, that low-level hypoxia leads to chronic fatigue, headaches, and just generally impaired cognitive performance.
You're starting a high-stakes procedure with your brain already running on low battery.
Your safety margin shrinks dramatically.
And on top of that, you have the soundtrack of the flight. The noise and the vibration. Helicopters are, they're notoriously bad for that.
They are. We're talking constant low-frequency vibration and noise levels that are often way, way above what OSHA recommends.
And for anyone listening, OSHA is the Occupational Safety and Health Administration.
Right. They set the standards for what's a safe level of noise in a workplace. So when we say well above, we mean loud enough to cause permanent hearing damage over time.
So this is much more than just an annoyance you need earplugs for. How does it drain you physically?
Well, in the moment, that noise makes communication incredibly hard. You're shouting, you're repeating yourself, your brain is working overtime just to filter out the engine roar.
So your mental load is through the roof before you even touch the patient.
Precisely. And the vibration, people don't think about that as an injury source.
I wouldn't have known.
But it is. Besides the obvious hearing loss and tinnitus, you're constantly subtly bracing your body against that shaking.
Just to hold your hand steady.
Just to be stable. That creates chronic tension in your back, your neck, and it adds to that cognitive fatigue because your brain is just constantly trying to process this unstable environment.
Okay, so we've got the air, the noise, the shaking. What about just the space and the temperature?
Thermal stress is a huge and I think underappreciated factor. 1 minute you're on a freezing tarmac at 4 a.m. The next you're in a boiling hot cabin during a summer loading wearing a dark flight suit.
Your body's just constantly trying to regulate.
Constantly. And that burns energy. Chronic cold can make your joints ache. It impairs your dexterity. And the heat. That can lead to dehydration, electrolyte imbalances. It all just wears you down.
And then you have to actually do medicine in what's basically a closet.
A moving, shaking, loud closet. The ergonomics are terrible. You can't adjust the butt height. You can't move the lighting.
So you're just contorting your body.
You're kneeling, you're reaching, you're twisting. And all of this while wearing a heavy helmet, maybe night vision goggles. It is a guaranteed recipe for chronic back pain, shoulder problems, neck issues, you name it.
So when you stack all that up, being hypoxic, shaken, too hot or too cold, twisted into a pretzel, it's suddenly very clear why fatigue management isn't just some HR policy.
It's a life-saving system. It has to be. The sources we looked at really stress having fatigue tracking sheets and a culture where you can actually say, I'm not safe to fly, and call out for crew rest.
Without getting punished for it.
Without any repercussion. If your organization doesn't have that, it's a major safety issue for you and for your patient.
Okay, that is a brutal list of demands, and that's just the environment. So if flying is the sprint, let's talk about the marathon, the hospital floor.
Yes. The stressors are completely different, but the cumulative damage is, well, it's just as bad in its own way.
The exertion is immense, but it's kind of invisible, right?
Totally invisible to the outside world. We're talking about basic patient care that requires a huge amount of physical effort over and over and over.
Like what? Give us a few examples of that daily grind.
Okay, think about turning a patient in the ICU. You do that every 2 hours to prevent bed sores, or mobilizing someone who can't move on their own, or just lifting a patient from a gurney to a bed.
These aren't just one-time things.
It is nonstop for a 12-hour shift.
And people hear about the miles nurses walk, but when you actually see the number,
It's staggering. Many hospital providers are clocking 5 to 7 miles a shift, sometimes way more.
That's a half marathon every 3 days.
A half marathon while pushing heavy equipment and running to emergencies. And they're doing it on, let's be honest, concrete floors.
Which just destroys your body over time.
It leads directly to chronic issues, foot pain, knee problems, hip replacements, varicose veins from all that standing.
And that's just the orthopedic strain.
Yeah.
What about the systemic hazards, like shift work itself?
Oh, shift work is probably the most insidious part of it all. Constantly flipping between days and nights. It messes up your sleep, your circadian rhythm.
And that's not just about feeling tired.
No, not at all. It fundamentally increases your risk for really serious stuff. We're talking cardiovascular disease, metabolic syndrome. It even weakens your immune system. You're basically trading years of your life for the job.
Then there are all the little micro traumas, needle sticks, chemical exposures.
Radiation in the cath lab, yeah. And all the repetitive strain stuff from the modern hospital. Things that seem minor, but just build up. Like constant hand washing. Absolutely necessary, but it destroys your skin. Or staring at the electronic medical records all day, giving you eye strain and headaches.
Or carpal tunnel from all the charting and clicking. Don't forget the maskne from wearing N95s all day.
Exactly. It's this constant, low-level physical assault that adds up to a huge debt over time.
And you can see that debt when you look at the official injury numbers.
You really can. The Bureau of Labor Statistics, the BLS, their data is crystal clear. Healthcare workers have an outrageously high rate of musculoskeletal injuries, mostly from all that patient handling we were just talking about.
What do the numbers actually say?
In 2023, the BLS reported 562,500 non-fatal injuries for healthcare workers.
500,000.
500,000. And over half of the injuries that caused people to miss work were just sprains and strains. It's an epidemic of back, neck, and knee pain. And nurses are at a much higher risk than the average worker because of all the walking, bending, and lifting.
And that's just the strain from doing the job. Then there's the part that's, well, it's horrifying. The physical harm from other people.
This is the number that really stopped me in my tracks. According to the BLS, healthcare workers are 5 times more likely to experience workplace violence than people in other professions.
5 times? How is that even possible? Who is doing this?
It's overwhelmingly patients and their families. And it's so high because, unlike an office job, you're in constant, intimate contact with people who are in pain, they're confused, they're scared, they're altered.
So it's verbal abuse, threats.
And physical assault. It's tragically common. And while nurses get the worst of it just because of time spent at the bedside, doctors and techs are increasingly being targeted too.
Do we have any numbers on how common it is?
The surveys are disturbing. The American College of Emergency Physicians found 85% of their members believe violence is on the rise, and 91% said they've been a victim themselves.
91%.
And a 2024 survey from National Nurses United found that over 81% of nurses experienced some kind of workplace violence just in 2023. This is not a rare event, it's routine.
So if it's that routine, why don't we hear more about it?
Because it's massively underreported. The sources are pretty clear on this. Workers feel like there's no point in reporting it.
They don't think anything will be done.
Exactly. They feel there's no system to protect them, so why bother with the paperwork? Which means these awful statistics are probably lower than the reality.
And the outcome is obvious. This constant threat just accelerates burnout, turnover, and then you have staff shortages, which makes patient care worse. It's a vicious cycle.
It is. It leads to chronic pain, early retirement, and just way too many career-ending injuries.
Which brings us to the central paradox of this whole thing. You are expected to be this healthy, strong, resilient person, an industrial athlete, really, so you can care for very sick, very heavy patients.
Right.
But you're working in conditions, from high-altitude flights to violent ERs, that are actively, systemically designed to break your body down.
The institutions expect individual superheroes, but they provide, frankly, substandard safety and ergonomic support, not enough patient lifts, not enough security, constant pressure to work when you're exhausted.
Okay, so let's talk about prevention. Because just telling people to be more resilient is clearly not the answer. What can an individual provider do to protect themselves?
On the individual level, you have to be strategic to survive. The sources are really direct about this. Focused strength training, learning proper ergonomics. Basically, you have to train like an athlete.
Which also means eating like one, right? And things like good shoes, compression socks.
All of it. But the biggest piece is recovery. You have to treat recovery like it's part of the job. You have to take your vacation time. You have to take your breaks. You have to prioritize sleep. You just can't do this job 24/7.
That's the individual side. But the real change has to come from the top. right? What are the institutional responsibilities here?
The institutions have to invest in making the job survivable. That means proper patient handling programs, buying and maintaining patient lifts, having enough staff so one person isn't trying to move a 300-pound patient alone.
Using dedicated lift teams.
Yes. It shouldn't be a nurse's job to do that kind of heavy lifting. And on the violence front, the system has to step up.
Wow.
More security, maybe monitoring for weapons at hospital entrances, and actually enforcing zero-tolerance policies for abuse, whether it's verbal or physical. It can't just be about telling staff to de-escalate. It has to be about protecting them.
That makes sense.
And that kind of brings us to the final thought we wanted to leave you, the listener, with. And it's a question, really.
Go for it.
So we've established that the strength and fitness that healthcare workers build in their own time at the gym, on their hobbies, directly benefits their employer. It makes them better, safer, and more durable at work.
It's essential maintenance for the job.
It is. So the question is, what institutional structures could be built to formally recognize that, to actually support and maybe even financially subsidize that athletic maintenance that's so critical for having a long career in this field?
That's the question we need to be asking. We've covered everything from, the effects of low oxygen in a helicopter to the damage from walking miles a day, and that truly shocking statistic that healthcare workers are 5 times more likely to be victims of violence.
And the message is simple. Whether you're in the air or on the ground, you are an industrial athlete. The job requires incredible mental strength, yes, but it also demands a level of physical resilience that is just not being supported by the system.
A powerful thought to carry with you as we wrap up this deep dive. We hope this gave you a real shortcut to understanding the true physicality hidden under the scrubs and white coats.
And we hope it got you thinking about what needs to change to protect these providers.
Thanks for joining us.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.